Gosh, I can tell you've learned so much. Your time as an entrepreneur, from the time you were a physician, just by the language you use and all of the different perspectives you've gained. Is there anything that doctors need to unlearn who want to take on the business side?
I think you, so one thing, physicians tend to have to be forced to learn continuously because things are changing continuously. So
Okay.
I think, if anyone comes into it with that mindset of like, I've learned everything I needed to know in med school and residency, and now I'm just going to continue, if someone has that, they're sorely mistaken just for being a physician. That's not the way the world works. You're learning more after you leave your formal education and training. You're learning more all the time. And so I think assuming people have that mindset, they need to apply that to things like system change and technology, and more physicians need to understand, the nuances of what machine learning is and the mistakes, the positives that can happen from it. And then the really areas where you can fall down upon using technologies like that. And I think opening and being open to working with different stakeholders. And again, this is a quality improvement thing. I was teaching at University of Kentucky. I was teaching a lecture to new leaders coming up. It's like, here's how you manage change and what a PDSA cycle is, plan, do, study, act, and quality improvement and some of the, and I basically telling people, you have to go learn the process completely, talk to a bunch of different people. The answer's not in your head. If you think it is, unlearn that right now. Right. And I kind of joked, get over yourself. This is not about you, right? And I think that's the biggest thing for physicians to unlearn, or anyone that's in a leadership position is like you have to go down to where the work is and look at it, be empathetic, listen, learn, because that you're going to hear the answer, you're going to hear the solution there, or maybe the people that are in the front line are going to have the best idea because they're in it constantly, and so they're going to tell you what's wrong, right? So that's how you can kind of build. And I think that's the biggest thing. One of the biggest things to unlearn, and then understanding that there is a business to medicine, there's a business to healthcare, there's a business to innovation, and you're gonna be better off if you learn what the rules of that game are. If you want to succeed, I pushed that off for years, and I thought, this is, and I was like, that was part of my reason for wanting to stay as an intrapreneur, because an entrepreneur. You can stay in the company. I still can get paid my salary and I have to do all my other things. You still end up working over 80 hours. I worked a lot because I did everything on the side. Right. And I had to do my day job, and I was a division chief, and I was a director of a region at one point, I did all this stuff. Right. And I did that entrepreneurial work on the side, but I knew it's like, okay, well, I know I got my grant funding. I know this is easy, and then I know I'm getting paid a salary. So it's like, okay, I'm fine. And I was avoiding learning the institutional part of the business, right? So when you go out there, the advantage is, as an entrepreneur, external, now you can be more nimble, and you don't necessarily have to react to all the processes that are laid out by your company, which can be a good thing, can allow some more flexibility. But now you have to learn the business world of God. You have to go fund everything you're doing, and you can't just fill out several grant applications and get internal money anymore, or be kind of covered and have a buffer. So you have to learn that business world. And some of the best ways are basically talking to other investors or people that are VCs, getting involved in accelerators and incubators, reading about what venture capital is. I started doing that, and I'm like, what? This is how it works? And my brother-in-law was a VC, and I'm like calling him, I'm like, it's like, wait, what's an LP? An LP has to bring you money, and I give you money, and then I make money later. But what, to join the club, I have to bring you $100,000. Really? That's how, understanding some of these things, and assuming it's like, oh, can I go be a consultant for a VC firm? It's like, oh, well, it doesn't work that way. You actually pay in, and then you do that. And I'm like, what? But it's just interesting to learn some of these things. I think it's important to have eyes wide open about what that is, and what's an angel investor, and what, you have to learn that, and then start having conversations, and that's going to help you. I think, it certainly has helped me be more brave at entering the market of externalizing and being an entrepreneur, and then learning about what you have to do and how the message is different. And then what we have to do for due diligence, which is actually really important. It's like, hey, did you actually estimate how your customers are going to grow? And it's like, what? Why do we do that? And how much you would charge for each? I'm like helping some of my friends in a nurse-led startup that's actually forming, and I got them in an accelerator. And I say, well, what are you going to charge each customer? How are you going to grow the product over time? How are you going to get into pilot studies? And they're just like, what? I just had this great idea. It's like, hey man, this is the thing. It's like, do you want to do this or not? Why do you want to do this? And they're like, well, I really believe this is going to help all nurses everywhere. Then this is the work, and
right,
so,
right.
But it's nice to have people that you can have a conversation like that with, that have learned. And I found people to help me in that journey, but it took a long time. And so I try to pay it forward when I'm interacting with people, or people call me, and try to tell them all that I've learned, and I'm still learning right now. Right. But, it's helping people to get started or set expectations. Or sometimes people are like, gosh, I don't really want to do that. And I'm like, that's the most important thing, is like, know what this is. And if you want to go on that big, hard journey, it's going to be less secure. You're going to make less, but you may be more fulfilled, And I was talking to one of my friends, Rupp Berman, who's a great intensivist out of UCSF, and he formed a startup at a time when I was still doing the intrapreneur thing, and working on my second product over at Kaiser, and he was in the Y Combinator, and I saw him. He was just like, oh man, it's like it was just so stressed out, by this. And now I see him later. I talked to him like a month ago, and he's like, his company's really Unlearn Health. It's a great company, doing education for nursing staff, and
Awesome.
and doing a lot of stuff virtually. And they're growing, and I think I can't remember if they're Series A. I think they got their Series A, and they're moving on toward B. It's just amazing stuff he's doing. And I was talking to him like, weren't you scared about the risk? And he's like, well, it's not the same. I could have made more as a doctor, but I'm more fulfilled. I've done something that brings more meaning. And I was like, I could just see.
Sounds like the name of the game. Yeah.
Yeah, I could just see in him. He was so relaxed. He was so like, this is the right thing that I need to do. And I was like, all right.
Right.